Daniel Ronquillo. I'm a recreation therapist in Tucker Pavilion. Also, I'm the animal therapy coordinator for both Johnston-Willis and Chippenham, which encompasses the pet therapy program for CJW. About, I'd say in the early 2000s, maybe late 90s, I was really interested in let's start a program. The hospital was already pursuing it to a degree. It took a good 2 years just behind the scenes of a lot of background work, coming up with the policies, procedures, everything to propose the program. And in 2007 is when it was approved, and we've been going strong for about 10 years. It started out with one dog. Frazier, who worked here for almost 10 years. He passed away in January. He pretty much headed up the program. About a few years later, he came on board. And then I slowly started getting requests for folks who had a therapy dog, can I come into the hospital? So at that point, I had to develop a different aspect to the program where I would get them approved, have them become a volunteer, and then come in with their own dog. And we are now up to 10 dogs throughout both campuses. In the next few months, I hope to add a half dozen more. My goal is offering the ability for the dog to help in the healing process. Whether we're talking about a psychiatric patient in Tucker Pavilion or a medical patient, of both campuses, they're coming in with a lot of anxiety and emotion depending on what they're here for. So by visiting the dog, for a moment they're forgetting why they're here. Sometimes I'll say, this is your animal while you're here. And they really do treat not only Schaffer, but all the dogs that I have here, like it's their own. How they're interacting, I think, is my favorite thing to see. For example, a patient who might be a little fearful or a little hesitant, they change their attitude after watching how others interact, and they might occasionally come into the group, sit, maybe try to pet him. And it was effortless between both the patient and the animal. They neither one has to even try hard. It just happens.